Well, we've got a wonderful docket of panelists here today for our discussion on promotores, community health workers, and their role as we fight against COVID-19. I'm going to go ahead and get started because we have some great expertise here present with us today. We want to make sure that we have plenty of time to address the role that they have played in the past few months, as well as within their careers. You will note that their careers are very extensive in the area of public health, outreach, and improvements of public health within our comunidad. My name is Rebecca Chavez-Halp. I'm a former Utah state legislator and have been actively involved in working on health access issues for a number of years, and most recently have been working in the state of Utah with a number of the great folks that you see here on this panel to address the concerns as have been impacted by our Latino community in Utah. We welcome you to the Overcoming Barriers and Building Bridges, Promotores, and COVID-19 Vaccinations and Outreach. And I am going to commit the bios of each of these wonderful individual panelists to you that was listed in the event listing and the event posting that you all have. But I'm going to introduce each one of them, and then Dr. Danielle will go ahead and help us get started with our panel discussion. As has been mentioned, please put where you're from in the chat so we know who is joining us this afternoon, and so our panelists can see who you are also. We do have a Q&A button down at the bottom of your Zoom screen. Feel free to ask questions, and we'll try to get to as many of those as possible. So today we have joining us Yehemi Zavala Orozco, who is Programs Director for Comunidades Unidas, Communities United here in Utah. We also have Dulce Diaz, who is Director of the Office of Health Disparities at the Utah Department of Health. We have Maria Lemos, who is Executive Director of Visión y Compromiso. And we have Amber Rich, who is Senior Community Partnership Specialist for Intermountain Healthcare, and our moderator and leader for the Latino Coalition Against COVID-19, our chair and founding member, Dr. Daniel Ternillo-Veras, is our moderator today, and I am going to turn the time over to him. So welcome to all of you.
Thank you, Rebecca. Thank you, everyone who are able to join in. We appreciate you coming to what we feel is an incredibly important topic right now, given the pandemic and given that our Latino communities have been disconnected to many of their own family members and also to many important resources that normally were brought to them person to person and then suddenly went online and became very difficult to access. This is part of our Building Health Equity and Advancing the Outreach to our Latino Communities series. This one in particular will be focusing on the importance of promotores and their role in building health equity in Latino communities. This series is dedicated to over the 100,000 Latinos who have passed away so far during the pandemic. And in order to remember them and appreciate their work and what their families are going through, we're here today to talk about some of the things that we can do to prevent this pandemic from continuing to have a disproportionate effect on the Latino community. A little bit of housekeeping. Please ask any questions that come to mind. We try to have a digitally equitable access to your comments. We want everyone to have a voice and allow your voice to be heard. And so the way it works is in the Q&A, if you can enter a question, and everyone has a chance to upvote the questions that they like. And so even if you don't have a question to ask, feel free to click on the thumbs up if there's a good question there, because that we're going to go in order of those that got the most votes from those that are involved today. We appreciate you being here once again, and we want this to be a conversation. And so we'll just get started right away. And I will begin with Maria Limas. She was already introduced, and I had the pleasure of meeting recently, earlier this year, as we talked about some of the important roles that promotores have and the important roles that are continuing to develop for promotores. Maria, for those in the audience who are not familiar with the term promotores or community health workers, how would you sort of explain to them your role and some of the work that you do?
Thank you, Daniel, and good afternoon. Thank you very much for inviting me for this discussion. Visión y Compromiso en our network of promotoras y trabajadores comunitarios started when leaders in our community wanted to share information. And those leaders were volunteers or they worked for agencies, but they were those individuals in the community who had what we call espíritu de servicio. They're the ones that were volunteering, taking food, giving directions, bringing resources. They are our tías, abuelitas, our tíos, our comadres, and it's a very natural position in the Latino community, actually in every community. And so that's what we call a promotor. And 21 years ago when we started, most promotores, there was really not much of a community health worker discussion. Most promotores were volunteers. They were doing it because of their love for their community.
Excellent. Thank you.
That's how we started. That's how we started 21 years ago, and now we're a national organization providing support to other states as well as Mexico and Guatemala.
Thank you. Thank you for sharing that. And as you were beginning to develop your organization, what were some of the first, goals of your organization, and how did you achieve those?
Well, we wanted it to be a democratic process. We wanted to really, we are promotores, I'm a promotora too, and we wanted to reflect the essence of who we are. So we're a very democratic organization where we come together and we define and decide what the issues are relative to our communities. We vote, we have consensus building, we're centered on a socio-ecological model, and we believe that everyone has a voice in that discussion. And so once we started with that and developed it in a popular education frame and really looking at the importance of the individual, we formed committees, and we have comités across California where everyone comes in and decides what's important. And what's important to one region, it could be very different from another region. And could be even contrary to what the Department of Health has identified as a priority. And so we really lift up the importance of issues because we believe the promotores not only know what the issues are, but they know what the solutions are. And so we build a capacity through leadership training and advocacy for us to speak our own voice and for us to speak our own solutions.
Excellent, excellent. Oh, thank you for sharing that. If we could maybe go across the panel and speaking of regions, each person here is working in a different region across the country. And if you could share a little bit about some of the work that you've done in your region and how you've been able to partner with other organizations where you're located. And we can start with you, Amber.
Sure. So I'm with Intermountain Healthcare, so we're a not-for-profit health system. And we were piloting some work around social determinants of health. So we were screening in a clinical setting and then connecting individuals to community resources. And we were doing that as a community collaborative. So we were doing it within our emergency department and our clinics, but then also with our federally qualified health centers, and we have local mental health authorities and some of our early intervention programs and things like that. And so we are working with an outside organization. It's the Association for Utah Community Health, and I think they've really been the experts in, we call them community health workers in our community, and they've done evidence-based training. They're non-licensed, but they have fantastic evidence-based training. And so they work really within the whole community. They belong to the whole community, and they get referrals based on criteria. And then as COVID came about, our clinical screenings are going way down as people weren't going into clinics and weren't going into EDs. And as were our community health worker referrals, which we knew was ironic because at the same time we knew that need was going up, social need. And our community health workers are very much focused on helping us address social need and connecting all those pieces between physical, mental, and social care. And so we started creating daily lists of them for individuals that were COVID positive that they could do proactive outreach to and do a brief social needs screening and then help connect them to resources. So it's really become, it's grown and it's pivoted. We're still doing clinical screenings and looking for social need, but now we're actually just going out directly to those individuals that screen COVID positive and trying to find individuals that might need some support that way. And all of our whole team in one county is Spanish speaking, and our population, our Hispanic population and Latino population in Utah is about 14 to 15%, but about 60 to 70% of the individuals that they are serving are Latino. So it's a much higher proportion of that population that they're reaching out to and connecting.
Got it. And
thanks.
And so you're the lead on the Alliance for the Determinants of Health, which was sort of like a pilot. And what would you recommend for those who are also involved in maybe a similar pilot, and how you could successfully scale this into a sort of a larger project?
So that's exactly where we're at. The formal demonstration of the Alliance ends this year. And so we've created some mechanisms that we think keep the community health worker structure sustainable for at least the next 2 years. And we're hoping and crossing our fingers that reimbursement develops within those next couple of years. But Intermountain pledged a $12 million charitable contribution for this Alliance project. So we use that funding to help fund our community health workers for the 3 years of the demonstration, then at least another 2 years. And now we're scaling this we're moving to a couple of rural areas to scale this. This is failing forward as far as I'm concerned. Every time we try to, we've moved forward, it's been a lot of red tape in terms of compliance. I think the general population and probably all of us on this call understand the importance of social determinants to health. And none of us would argue with that, but policy and reimbursement and compliance is still catching up. And so we've also got a lot of focus on the policy piece, because I think to make this sustainable, we're going to need reimbursement. We're going to need some funding outside of grants and charitable contributions. And so that's what we're looking to and hoping that we can sustain it through that. And then the other piece that's been very important for us is having to have a referral process so that these different organizations can work together, and we have regular care coordination meetings. We take our community health worker teams into every major community partner that they'd be interacting with, and we help define what their role will be within that organization, because it's a little bit different in the federally qualified health center than it is in the school district, than it is in these different organizations. They all have different structures and things. So we try and figure out how this role interacts with those organizations, and then meeting and coordinating on a regular basis so we can continually refine that process. Because we've just found that most organizations, at least in our communities, are not very familiar with this role, and they need a little coaching on how to actually incorporate it into the work they're doing.
And I'm just curious, what form of communication do you all use?
So we've adopted a closed loop digital platform. We're working with Unite Us. Anyone's familiar with that platform? Mm-hmm. There's others out there like Aunt Bertha and now Powwow. We've gone with Unite Us, and it's worked well. And again, that's funded through that charitable contribution. But that's how we primarily work the referrals. And then our community health workers have championed that, because they're the ones that are connecting the individuals to those resources. So they're sending them through that platform. And they've really been our champions that have sparked the whole community use, because the more they send out those referrals, the more the other community partners get engaged with it.
Got it. Thank you. Thank you for sharing.
You bet.
And Yehemi, representando Utah. Thank you for joining. I'm always very interested in Utah, just because I find that they're doing a lot of unique things in unique, creative ways. Maybe if you could share with us some of the work that you're doing and how you've been able to partner with others in your work.
Of course. First of all, thank you so much for having us here today. So I want to share a little bit about the organization that I work for. Comunidades Unidas is a local nonprofit organization in the state of Utah. It's located in West Valley City, which is one of the most diverse cities in the state. And it has a huge amount of Latinos specifically that we work with. So we make a center for community members to be accessible for them here in the city. We started 22 years ago. Yesterday was also a day. And it was based on a need. Most of the people who created our organization were promotores comunitarios, and they saw the need. Unfortunately for us, because we weren't the majority, or we weren't that many people here in the state, there was not accessibility, neither resources for our community members to get healthcare. And also there was a lot of discrimination, racism, we know already. And so what they decided was to do something about it. And if they were not, or we weren't having opportunities that were making us be more healthy and self-sufficient and successful, then we create something. And so we honor that work, right? These monolingual immigrants started this organization, and we just continue to work with them. And so we most of these founders of our organization not necessarily stood here at the organization, and they are in other organizations. So I think that Maria can agree with me that when we are promotores, I am a promotor as well. I started at Comunidades Unidas as a promotor, and we just need to continue connecting each other. It's so important because this is not, this is our country now, but we have this melancholy about what was in our country, or how we were facing things in our country, that connection with each other is so important. Even though, for example, I didn't know Maria, we found her 7 years ago. And we were able to ask her for guidance, because we didn't know everything, and we felt so isolated, as you were mentioning. You said those things very particularly, and so we just thought that we were alone in the fight, or that we were alone in what we were doing. And so connecting with other agencies such as Visión y Compromiso and in Texas and New Mexico were super good for us. And the network that Ventanillas also offers to the Mexican consulate is another one that is really helpful for us, because we have seen that we are not alone in this fight. Or we know, and being a promotor, I think that is a lifestyle. And it's something that you born, or that you are taught. My mom taught me to be a promotor. My grandma taught my mom to be a promotora. And so, my family, at least, it's generations of promotores working, not just here in the United States, but also in Mexico, which is something very informal that we are paying attention right now, and that makes us feel very, very happy, because the work that we do is connection, and to make sure that our community members can get the connection to what they need, but also that we have a spiritual connection, and that we create a sense of community that makes our communities just to grow better and more strong.
Thank you for sharing that. And that's when I first reached out to Maria to organize this topic, that was one of the really important pieces, was the sense of connection, and the fact that this is new to us in the United States, but this comes from a long tradition of community involvement that has been going on for years and years and years in Latin America and other parts of the world. But it's something that we're slowly realizing is a critical piece in having health equity and population health and across the country. So thank you for sharing that. And you also talked about staying connected. How are some of the ways that you've been able to stay connected in this pandemic, where we've all been forced to be disconnected from each other?
I think that it has been one of the most difficult things ever. The promotores that we work with here in our organization are from 15 years old to 75. So you have this wide variety of people that have different capacities in how to utilize technology. Fortunately enough, everybody has WhatsApp. Everybody has, the main Facebook, and so we have to make sure that we understand how to use these platforms, because as yes, connection is what is most important for us. We were so thankful with Visión y Compromiso last year that they were able to provide the training or the conference that they do every single year. And even though we couldn't go and hug them, because that was also super important for us, at least we were listening to them. We were listening to what other promotores were experiencing, because yes, the pandemic was such a devastating situation for us, not just because we had to work, right? But because we were affected with it, our families were affected with it. And unfortunately, not every single promotor or community health worker is as a documented person. Some of them are facing, that they don't have the same relief, they don't have the same opportunities or the privileges that, for example, I have, such as being, working from home. They will have to go into the testing sites, they will have to go to the vaccination site, and they will have to risk their lives every single day to make sure that our communities have what they needed.
Exactly. Thank you for sharing that. Dulce, I don't want to keep you waiting any longer. I believe you're also from the same neck of the woods as your partner in crime just above you. Do you mind sharing with us some of the work that you've done and maybe some of the successes that you've been able to reach?
Yes, sure. So I'm the director of the Office of Health Disparities at the Utah Department of Health, and you can see that I'm now at the Department of Health, and my background is not as nice as yours, so I apologize for that. During this last year and a half, the work of the Department of Health has been exhausting, and the work of the Office of Health Disparities has been really trying to create this collaborative with community health workers to really address COVID disparities among our underserved and underrepresented communities, the Latin community among them. So it's really incredible to see how the project has grown and how, COVID just has been like an eye-opening for everybody to really see that the disparities that we see in COVID are because of the inequities that we have previously. So I will give you a clear example. We started the COVID Community Partnership Project back in April last year. The COVID Community Partnership Project is a collaborative project that incorporates community health workers or promotoras into the COVID-19 response to address marginalized communities, including racial and ethnic minorities. We start with $250,000 and just a small project working with 11 community-based organizations. Right now, we have a budget over $30 million, and we have direct contracts with 40 different agencies and indirect contracts with another 20, including community-based organizations statewide, all the tribal governments, all the local governments, different academic institutions, the Utah Association, the Utah Public Health Association, Community Health Workers section. So it's really amazing to see the work, specifically talking about the promotoras, to see how much we are learning with them and from them. We will not be able to achieve this project and to do the things that we are doing or accomplish right now without the promotoras. The promotoras, they are the eyes of the communities, they are the connectors, the trusted partners of the communities, and they are key. They are key for any success in working with underserved, underrepresented communities. So we are here to support them. Right now, we are working to help them to build internal capacity, to really become more powerful. Also, something that we started with this project is like, and it was inadvertently, is like we set up like a minimum salary of $18 an hour for community health workers. And again, I remember that we have only $250,000 at the beginning. And many people were kind of, why do you establish like a minimum payment? It's like, that doesn't mean that they cannot go over that, but at least we want to have this minimum payment because we recognize how dangerous this work was, and maybe they were not compensated enough. But it's like we need to start establishing this kind of really processes and standards. It's like, okay, they deserve more, and that's something that also we want. Right now, in the current contract that we have with community-based organizations, with all the local health departments, we have integrated community health workers in all the local health departments, in the tribal governments, in different community-based organizations statewide, and we really have like, positions that are really good positions. So it's like full-time positions with benefits, because we need to acknowledge that. We need to acknowledge that we need to create quality jobs for our promotoras, because they are key, and they are key to really advance health equity at the public health level and also in the healthcare system.
Exactly.
Daniel, this seems can I add to that?
Yes, definitely.
I think that what Dulce mentioned is really what we hope to happen, which is the integration of the promotor model across health, mental health, all sectors. And for any Department of Health that's listening, the integration can be across sectors from preconception to death, if you think of the model and how useful it can be. COVID has proven the importance and the significance of a promotor going out in the community and accessing us where no one else was able to reach us, being able to bring us in and talk about COVID, about vaccinations, the importance of the hesitancy issue. And I think it has really proven that the community model, the promotor model, is essential to health and well-being. The caveat here is that as we're supporting CBOs and institutions to integrate community health workers or promotores, that if there isn't a really flexibility in the hiring process or in the training and resourcing of promotores through the workforce, then we lose a lot, and we get a different kind of a promotor. We may get a promotor or look for a community health worker that may have a higher level of education, speak a higher level of English, which oftentimes may not be the promotor that we're talking about. It's the grassroots promotor. And that's where we start looking at resourcing CBOs to the extent that they can hire, and because their hiring practices are usually more flexible. But there's also a training component, there's a response component to that, and the credibility of the community is going to be in how true are you to hiring and to supporting those local experts. And I think that that for those that are listening, that's going to be really important. The warm handoff is to partner with community-based organizations to bring forward the grassroots community promotor, as Henry was talking about, the ones who are really out there doing the work day to day.
Exactly, and this was something that came up recently in a discussion. Biden has talked about on several occasions the need to go door to door if we want to get our vaccination rates up to a number where we're getting closer to herd immunity, as that number obviously is changing with the Delta variant. The first thing that came to my mind was we need to hire lots of promotores. We need to fund promotores in every community, because we know that its trusted messengers are the ones where you can have this kind of conversation in these communities. But I don't see that happening. I mean, I don't see that part of the door-to-door plan. I was just wondering where you guys are all located. Has anyone talked about this door-to-door vaccination plan? And is there talk of getting more promotores involved so that we can try to protect our communities?
Well, in California, there is that discussion. And I think there's a misconception of, and not a distinction between a community health worker and institution and a promotor. And so those, and should they be certified? Should they have college degrees? All those really develops a barrier between the community and the institutional community health worker and promotor. I don't think Biden understands that. I know our governor doesn't understand it. He may now today, but if those nuances is what's going to defines which community is going to be represented, who's going to get paid, and what kind of success you're going to have.
Right.
And I think, Daniel, John, yes, in Utah, we already implementing the door-to-door, and we need to acknowledge that we have a wide range of community health workers with different maybe qualifications at the educational level and also with different skills. And I think that it is important to recognize that we don't have just one type of community health worker. We have many types of community health workers, and everybody should be part of the system. Is like, do we need to request that everybody will have a bachelor's degree? No, of course not. And maybe some of them don't even have like a high school diploma, but that doesn't mean that they are not good doing the work that they are doing. The reason we are thinking about maybe a certification here in Utah is because when we think about sustainability, how we can sustain the community health workers workforce. In order, let's say, for them to be reimbursed by Medicaid, they need to have some type of certification. And that certification, again, doesn't mean that they need to pass like a very complicated test or anything like that. That's something that Angeheni can talk about that because she's involved on that. Is like, we really need to make this certification flexible enough so we will be able to certify, all type of community health workers, and we'll be able to certify. I call them the Señoras Maria because it's like, I know it's like the people that maybe they don't even speak Spanish, but they really know the community and the community trusts them. So it's like they are selling promotoras and yeah, it's like we need to find maybe a certification that will fit them too.
I think that's a very interesting point you bring up about certification because CMS nor any other federal government requires a certification. They want us to look at a certificate of competence. That's different from certification. So the movement towards certification in the states is a misnomer, and it doesn't really get to the issue, which is core competencies or certificate of competence. And I think there are a lot of states who are moving in that direction that unintended consequence could be really forming a barrier between community and passing that quote certification that they validate.
Yeah.
Yeah.
On that point, go ahead. Go ahead.
Yeah. No, I just wanted to ask you what you were mentioning. Why don't we see them outside? Why don't we see promotores? Because I think that it's important also to recognize not necessarily promotores are community health workers. Not all community health workers are promotores. And I know that we can go into the chicken and the egg in these circumstances because I know that we have had these discussions for several years. But something that I do want to bring again is most of the promotores or the promotores that are working in the community, the promotores that you are talking about, are promotores that might be undocumented. And how we're going to bring them to the table when we don't even acknowledge their existence and we don't want to pass a pathway to citizenship for them, that they are helping. The movement in Promotores didn't start with Comunidades Unidas, didn't start with María Lemus and Visión y Compromiso. It has more than 50 years. And the CDC saw the importance of the work that we do. That's why they send them to the fields to talk about HIV and AIDS. That's why they talk about infant mortality. But the problem that we have had, again, and I do want to emphasize this, we're talking about systematic racism, and we need to call it by what it is. Why we are calling it systematic racism? Because in order for us to recognize and bring those promotores into the table, we have to recognize that they deserve to have a pathway to citizenship for them to work and have the salary that they deserve. If we're talking about certification or not, that is going to depend on the state and how, community health workers or promotores are moving forward. But the point here that we need to recognize is that promotores, generally speaking, they are part of the community and they face the same struggles that the community has. And so with this, if we do not talk about the way undocumented promotores, so the people who do not have the opportunity to get reimbursed from Medicaid, or they don't have the opportunity to go to learn English or have a degree, it's not because they don't want to. The circumstances in which we have right now immigrants in this country, promotores in this country, is very particular from us.
I think one of the things, Daniel, that we're supporting is really resourcing community-based organizations to be able to hire more community promotoras as an answer to the workforce issue, as opposed to continue to fund universities or associations or those kinds of things that bring in a particular kind of community health worker and maybe not the grassroots promotor. We want to find ways to incorporate our community promotoras. So we're looking at things like the regulations, like an ITIN number. How flexible can that be? Looking at policy things that will, at least until we get a path towards citizenship, really look at including and embracing our community that's doing all the good work. COVID has proven that there's an army of promotores out there willing to work, and that they can do the work, and that they can make a difference. And they are the change makers. So how do we deconstruct this public health system that relies on counties and on states and on universities and our typical institutions to really embrace the community model and embrace and resource and support community?
I think these are all incredibly important pieces to this herd immunity. I mean, everyone's talking about, let's get vaccinated, let's get to herd immunity. We need a pathway to citizenship. For everyone who was able to stay home when there were stay-at-home orders, we still had campesinos going to the fields and collecting the food so that people could eat at home. These were things that were necessary. And a lot of them are undocumented, and we pretend that they're invisible, but they're not. And until we are able to create ways that secure their lives and allow them to continue the work that they do, I'm in full agreement. And the piece about certification. So my mother was a Spanish interpreter, and she was not certified. She was the best interpreter. I'm very biased, of course, but she was an excellent interpreter. But, for different reasons, some people, it's difficult to be certified, and I feel that they should still have a fair opportunity to do the work that they want to do, especially in times like this where we need more promotores than there are in order to get the work done. And so I think certification makes sense because it does provide a way to regulate and reward those who have, done the work to get certified. But in a pandemic, I feel that there needs to be a way to scale programs quickly in order to get to those who are vulnerable and could be otherwise without resources that are necessary to live a safe life. So the idea of policy was brought up, which I think is a very important piece. Does anyone want to talk about maybe some work that they've done related to policy that has helped advance the work of promotores?
I can talk about what's going on in California. Governor Newsom, about a month ago, put a line item in the budget that was allocating about $16 million, increasing over 3 years to like $200 million for community health workers and working with Medicaid for Medicaid reimbursement. And while that sounded like a really great idea, what it did is it eliminated promotoras because of who's tied to the Medicaid reimbursement, which is mostly the plans, the hospitals, and the clinics. And it didn't support the community. So we are in discussion. We have a stakeholder group of us who are talking and seeing how we can change that, how we can adapt it. But even the language, because it said community health workers, they weren't able to include promotoras or community. So there is a distinction, and I think that you have to make those distinctions between the institutional role and the community role. And reimbursement, in this case, it caused a significant blockage because now we have to figure out how the law is going to be implemented given those limitations. And so we're advocating, a group of us are advocating for funding to be resourced to community-based organizations. Now the question is what mechanism are they going to use? But this is a great model for the federal level as they're allocating a lot of funds. And Biden really wants to support the community health worker, but he should really say community health worker promotor, CHR. That's an education process. It's making the distinctions. It's understanding the role. It's understanding how does how does that get to the comadre on the street when you're talking about a CHW funding? And so the policy right now is really critical in understanding the broad world of promotores and community health workers and all those titles in between.
And is there work being done at the federal level for those policy
Yes,
changes?
there are people who are writing papers to submit to the Health and Human Services Secretary, who thankfully understands the promotor model, but he also is in charge of a huge bureaucracy, and CMS is the one that's the driver. So we're hoping to submit it to them. And we are also in the process of developing a national group called the Alianza, which is CBOs that are like-minded, that will advocate for the community model, so that we can really bring forward that there are those of us who not only are interested in the promoter model, support it, train, develop, but there's resources out there, and we have concerns about the direction that the funding is going.
And right now, if a Promotores group wants to receive funds to work on a project, if it's federal funds, are they able to receive the funds straight from this federal source, or does it have to go through an institution?
I don't know any. The government usually will send their money. CDC goes to states and to counties, and then HRSA money and CMS money goes a lot of times to academic institutions and to the state. So the mechanisms are very narrow. And what we're saying is expand those. Look at intermediaries. Look at CBOs. Look at developing the community capacity to engage in this discussion, not just the traditional organizations.
Got it. And the academic, go ahead.
Yeah, I was going to mention, and I think moving forward to create a better legislation of, policy and capacity for community or promotores specifically, because I think that we already understand that community health workers are not going to go anywhere. They're going to stay, and I think that that's wonderful, and we need them on the healthcare system. But what happened with promotores, right? As we were mentioning, when we're talking about promotores, and it's important to continue recognizing that, because that's the name that we have had for the past 50 years. And I think that it's fair to continue honoring that name, right? If you don't call the things by what they are, the name, you start to forget, or you start to forget the meaning. And I believe strongly that when we're talking about promotores, we do need to make sure that we think about race, we think about ethnicity, we think about how the practices that we are providing to create these new policies or these policies in our states are going to impact people of color, disenfranchised communities, people that have been oppressing for centuries, people that were also slaves or that are right now not being paid fairly or not being treated as human beings. All of those things we have to bring into consideration when we are doing this type of policies or these new policies, because that's what is going to make community promotores to continue, getting stronger, and also to support them in a very mindful way. I think that those things are going to be very important moving forward in any type of policy, right? Understanding that if a promoter, not every promoter is going to have documents, how are we going to pay them? Not every promoter is going to talk English as the first language. And not necessarily because they speak Spanish, it means that Spanish also is the language that they speak. We have promotores that speak another languages, that Spanish is the second language, that live here in the United States, that have so much impact in other communities across the country, that it is important to recognize and make sure that we are going to also make them part of the decision making of how to make policy happen and possible.
I just want to say, whoever said time certification to promotor certification to expedite citizenship, that's a very frightening thing to say. That you're going to limit expedited citizenship to a certification process that someone may or may not be able to pass. That is, and is developed by somebody who may or may not be in the community itself. That discussion of tying those two together is I think, problematic, to say the least. Certification is an issue that's related to the state and to CMS or to CDC. It's not related to reimbursement. If you look at the CMS ruling, they do not require certification. They require qualifications, statement of qualifications. They require a certificate of some sort to ensure that that person has met those qualifications. So there's a buzzword about certification, and we have a historical, there's a history of certification, Texas, of course, being the first one. but it works in some and it doesn't work in others. And so I think what we should look at is core competencies, look at the work that's been done in that area, and look at how does it support community, the diverse community that we're talking about, from the farm worker in the fields to the educated individual.
Exactly. And so we have 12 minutes left, 13 minutes left. What I'd like to do is give each of you 3 minutes to share your final thoughts. Maybe share with us what is next. What needs to be done next? What's the next step in order to advance the work of Promotores? And we can start with you, Amber.
Sure. I wanted to interject a little bit about this conversation that's been ongoing. And I think one of the things that's very important and what we're trying to look at as we integrate community health workers system-wide is how do we create a career pathway for individuals also? So I think that's an important piece of, and I know there's a lot of discussion and debate here about certifications, but I think we very much support this idea of core competencies and being able to take that cultural competence, which is invaluable, and making that top priority. And then giving opportunities though within that work, if we can get some understanding within our CBOs or within our health systems, the value of this role. But I think we still have to work within the existing systems. We need to still convince health teams and physicians and legislators how valuable this work is. And one of the pieces that we've done is, we have steering committees and other things, and we are always bringing in our community health workers to share their stories. And it brings to light this value for those that don't necessarily understand this role. And so that's been really valuable for us, is in promoting this work, is taking every opportunity that we can to highlight how important this is, because for as ingrained in the cultures it might be for some, it's very foreign to others. And for providers to see this, or CBOs to see this as a value, we have to demonstrate that. And so that's where we're continually trying to go towards, is creating this system-wide and making them a designated part of the care team who has a designated role that has values as equal to those on the care team, whether it's a nurse or a physician or other things. Like, this role is as valuable as those roles as part of the care team. And that really begins by integrating into the care team or to, the work group or whatever it is, and then sharing those stories and showing their value. So we are moving towards system-wide integration of community health workers, and we're investigating that. We're also working with Kaiser Permanente and looking at how we as two different health systems can leverage our influence towards policy. And then we actually have an national outside evaluation team for the Alliance. And a piece of what they're looking at is dedicated to policy and researching and with the Ken Gardner Institute at the U of U, what are the policies we can adopt, support, and leverage statewide and nationally as we share these findings. Thanks.
Thank you for sharing. Thank you and the academic community connection is, I think, a really important piece, because without the data, that's what we need, the data, so that the undocumented have a voice, so that we know that they're there, that they exist, that they have thoughts to share. And so I'm glad that we're finding ways to connect academics and academia with the community in a way that's beneficial to the community and is community focused and community led, so that we're making sure that the work that's being done is benefiting that of the community. So thank you for being here and sharing that. Orozco.
So in my case, or in our case as Comunidades Unidas, our takeaway in this is, again, to invite healthcare systems, to invite universities, to invite community-based organizations, to really think about the systematic racism that we have in our practices, inviting them and start to question them. We have done the process, not because we're people of color means that we, are exempt from it. I think that we all have to, continue doing research. For us to make space very intentional space for Promotores. The curriculum that we wrote is in Spanish. We don't have it translated in English. It was very tight and specifically focusing in Promotores to make sure that they will understand. And because we're working with Promotores, they were the center of attention, which it means that we couldn't write the curriculum in English and then translate it. That doesn't make sense. So think about the population that you are talking about and make those steps intentionally, because it gives you a totally different type of working. And the example that I have is myself and other community leaders that work in my organization. I started as a promotor volunteer without speaking any type of English 11 years ago. And now I am the program director of the organization, and also the person who has run the program of the Promotores for the past 5 years. And I can go on, and not just myself, but so many other Promotores that are giving the opportunity, but also create the environment for that to happen is going to be the key in all of this.
Thank you. And what was the key to your environment that allowed you to thrive?
They gave me the opportunity to provide my input, my ideas. They give me the money, the funding, they gave me the trainings, and they were supporting me in every single step of the way until I could help now to develop and create curriculums that are going to help, to sustain the programs.
Got it. Thank you for sharing that. Dulce.
So I think that when talking about the progress that we have made or we are wishing to make, I think that we need to see maybe the long-term vision, and also to keep thinking about what can we do right now within the limitations that we have to really improve the workforce of community health workers and promotoras. So here at the State Health Department in Utah, so yeah, Maria is right. It's like there is not direct federal funding that will go to community-based organizations because the application process is extremely convoluted. So most of the funding goes either to state departments or academic institutions. So right now, what we are doing at the State Health Department is yes, we receive the funding, but we funnel that funding to community-based organizations or local health departments that will hire community health workers or will allocate funding to community-based organizations. So I think that that's key. We really need to build the capacity among our community-based organizations. We need to empower our community-based organizations. That's extremely, extremely important. And at the same time, I recognize and I acknowledge that we need to have maybe some type of, and when I say certification, I'm talking overall. It could be maybe statement of qualifications, competency, whatever. So right now here in Utah, we are trying to see, because we realized with the certification agency at the state level, it was extremely difficult to certify undocumented immigrants. So now we are kind of thinking and maybe working with some legislators here in Utah to see if the Department of Health can become the certified body. And when I say certified body, we need to define that for community health workers and promotoras. So we can have undocumented immigrants just qualified to be promotoras. They can be reimbursed as a fair pay. So that's two steps that we are taking right now, just funding and building capacity among community-based organizations, incorporating community health workers and promotoras and local health departments, funding local health departments to fund also community-based organizations, and also work on building the capacity of the State Health Department to be the certified body for community health workers and promotoras.
Thank you. I'm not sure where the alarm has gone off, but Maria, if you could share us
yes, I would love to. Thank you. I just want to give a cheer and echo what Yehemi said. She is the example of what it is that we do. We provide resources, support, education, un abrazo every now and then, a little cafecito, and support that individual growth and development of the individual, the person who has those skills and abilities. And what has happened is over time, it's become a career pathway. We have our workforce papers that I'll encourage everybody to look at, where we look at the integration of the community of the promotor model and the steps that you need to do to support that individual to become an employee, either in a CBO or an institution. We do look at unintended consequences as a real issue, that if things are formed in a way that's not supportive of community, the unintended consequences is that you're going to get a different kind of employee. If you wanted my mother, who had a 6th grade education and didn't speak English till the day she died, but you require a high school education and English, fluent in English, you won't get her, and she's a promotora. You'll get somebody else, and oftentimes you'll get a Spanish-speaking non-Latino, which defeats the purpose of recruiting Latinos and trying to get us in. I think that the advocacy piece for this kind of community resource, the CBO as well as the individual, is really critical right now to recognize who the experts are at the community level, and to not just resource by sending money to the CBOs to hire, but resource them to be able to develop their organizational capacity to compete and also to sustain within their own communities and to understand the value that they bring forward. The certification piece, you heard my thing on that. I think it is core competencies, and there's a downside to that, where you could draw a line in the sand in who you're going to bring forward. I know many states who have developed certification have a grandfather clause, but that only goes to certain years, and it only goes to a certain community. It still does not necessarily reflect the whole community of promotores and community health workers. And I really appreciate what you have said about our indigenous languages. And even if we have English-speaking promotores, our Chicano communities, our 2nd, 3rd, and 4th generation that we haven't really spoken of, but of which are the majority of Latinos, we have literacy issues. And so this model can work for our community, our diverse communities, but we have to take into consideration who we are. A Tex-Mex is very different from a LA Mexicano, and the diversity of the Latino community across the United States, Dominican, Puerto Rican, Cuban, Venezuelan, Mexican, different kinds of Mexicans. I mean, my gosh, I think that we have, the systems have not really taken into consideration how diverse we are, and not just in culture, that one part of us eats pan and the other part eats tortillas, and some are flour and some are, the difference, but also in our age differences. I think, we are baby boomers also. Our large majority are either baby boomers or we're under 15. And I think we're such a diverse and complex community of Latinos that we really have to advocate for the diversity and for programs to be developed to reflect us. But given all that, we are successful. Misión y Compromiso and many of the organizations on the call have worked through the systems. We're successful in training and providing leadership and networks and organizations to support our communities. So that we have expertise, 20, 30 years of expertise in the community. And those of you who are listening who want to join us, look to the traditional experts. Do not try and reinvent the wheel. We've been doing it for a very long time, those of us in the community, and look to your local experts for support.
Thank you, Maria. Thank you everyone for joining today. Obviously, this wouldn't have been a conversation without you. And I know that hopefully we were able to answer some of the questions for those who were able to tune in. I think some of the work that we're still working on is the policy changes that help support the work that you're doing. And that's something that the coalition is involved in as well. The fact that Latino is a term, we get asked all the time, why aren't we the Latinx coalition? Why aren't we the Hispanic coalition? Why aren't we? So if you go to our website, actually, the word changes every few seconds, and it goes from the Latino coalition to the Mexican coalition to the Hondureño coalition to the Salvadoran coalition, because there is no one term that everyone agrees on. The most popular term is the country of origin, where you're from, and that's hard to put every country into a name. And so, but we need to realize that we should be trying to focus our messages based on personalized messages on where the people are from, since a blanket handout that's made for Latinos will not reach every single Latino, because we're not a monolith. We have many things in common, but each country is unique and has a story to tell, and that story should be told. And if for those who enjoyed this webinar or this virtual town hall, please join our next one. We'll be having one coming up. You can find out more on our website at lcac19.org. If you can, follow our speakers on social media as well as their organizations, because I'm sure they'll be giving updates on the work that they're doing. And if you're interested in continuing this conversation, I encourage you to join the coalition, and you can do that by going to our website and clicking on the About Us, and there we'll show you how to take the next steps and help amplify the voices of Latinos across the country that need to be heard, so that we can start building more health equity and a better